Oswestry is a vibrant market town, nestled sort of along the Welsh borders. On the surface it is a lovely town, but actually there are a number of problems around substance misuse and mental health. We've got more than 20 years difference in life expectancy between those who have a significant mental health condition and those who don't.
Health inequalities, they're not new. However, what the pandemic has done is to really exacerbate those pre-existing health inequalities and thrust them perhaps into all our consciousness. The Health Equity Partnership Programme was funded by NHS England and Improvement as a very practical and tangible way to support local systems and communities right across the country. And quite often it was about not reinventing the wheel, it was about enabling and accelerating some of the great work that colleagues were already doing.
Previously we did work in partnership, but actually the programme really galvanised the mental health trust, the GP practices, the primary care and the voluntary sector, along with We Are With You, who are our substance misuse service, together to work in a really coordinated way to build a recovery community in a way that promotes and improves outcomes for those people.
This is a creative design studio. We're funded by the HEP project. Members we get referred here have a dual diagnosis of a mental health challenge and drug and alcohol substance abuse. Members are referred to us through recovery partnerships and mental health services, often through their GPs, and they can self-refer themselves to our organisation.
We're going to do some screen printing today, and we're going to do it from paper cuts.
People with co-occurring substance misuse and mental health issues often struggle to receive treatment or support for both of those issues at the same time. Therefore, this community activities are so important for them to be able to explore both their substance misuse and their mental health condition through arts and through structured education.
I was referred by my GP and mental health nurse when I was in a place that I have inhabited 20 years ago with mental health issues. I was like a software engineer and I had a classic burnout. Anxiety, with it being such a bully, you need to have distractions from what's making you anxious, and concentrating on art and stuff like this is fantastic.
On days that I'm in a really good place, my art can be really good. And on days I'm not on such a good place, it might look like a 4-year-old did it. And that will be a good indicator of how I'm feeling, so then it can help me re-establish whether I need to be with people or I need to stay on my own. So it's really helped me understand myself on a much deeper level, yeah.
Not only does the programme offer a creative element, but there's also the mental health support from a specialist community mental health service called 12A in Oswestry. It's new as part of this programme, and what happens there are Calmer Cafe drop-in sessions, but also a 6-week programme for those who want to explore their mental health a little bit further and understand how they can improve their mental health in their lives. How was group today?
I thought it went really well, did you? Yeah. Part of what we do is refer people to other services in the area. When someone comes to the end of their 6-week course, we can talk about designs in mind with confidence, because we've been to the building, we've visited them, we hear the good feedback about designs in mind. We also know a fair bit about Shropshire Recovery Project as well and what they do. And likewise, it's nice for us to have referrals from those places as well. We all want the same thing. We all want our participants to get the most from their local community and from the Health Equality Project, and that's one way of doing it, connecting all the dots together.
Before, I wasn't very trusting of services at the NHS because it was all very medical, very clinical. And when you're really creative and a bit different, you don't really want that environment all the time. You want someone that knows what you've been through. So it's really important for people to talk more. That's what I always say, talk more about how you feel, because the more people understand, the more they can help you.
There's been great learning for the system around how the community can help itself, what's available in our communities, and if coming together through a programme like this can bolster that community activity to create real positive outcomes for people, has been a massive learning point for the system and something that we really want to take forward in other communities in Shropshire, not just Oswestry.
The co-production with local people and communities, I think, sits at the heart of the success of the HEP program, because it means that, you know, the interventions and the solutions that have been developed and implemented are meaningful in place, and they resonate with the people and the communities themselves.
We were able to, as part of the program, work through a leadership program that was offered as well, and what that did was bring together the key leaders within the program to really understand each other and also to learn from other areas, and that made the success of the program really as well, because we were able to take time apart and learn and work together.
I am absolutely convinced it's helping people. I've seen it. We see people make life-changing decisions, no doubt about it, it's brilliant.
It's a bit like meditation coming here. Without the art project, I would have been less able to get beneficial sleep, and to be in a better place where I am now would have took a lot longer, I think. It's thoroughly recommended, yeah.
Without services like this, I probably wouldn't be here, because I wouldn't have had that kind of acceptance of who I am. I think I would have ended up probably just staying at home, being very depressed, feeling like unworthy, and this has given me that sense of worth, purpose and focus.